Lesson 5. Laboratory tests for pulmonary diseases. Respiratory tract can be divided into two parts. The upper tract starts from mouth till trachea. The lower part includes the bronchial tubes and lungs. There are many different pulmonary diseases: infection, intoxication with smoke or gas, fibrosis, meaning the formation of excess fibrous connective tissue, pneumonia, this is an inflammatory condition of the lung, OCPD, chronic obstructive pulmonary disease, is a chronic inflammatory lung disease that causes obstruction of airflow from the lungs. Neoplasm is the abnormal growth of tissue, including cancer. Among these, I would like to focus to discuss infection. Respiratory infection can be caused by virus, bacteria, fungi. WBC differential count in the CBC test can firstly reflect our immune response towards respiratory infection. Lymphocytes involved in specific immune reactions to foreign matters, including acute viral infections. In bacterial infection, neutrophils will be phagocytes to engulf and kill bacteria. Eosinophils will be active in fungal infection and inflammatory reactions. Viruses account the majority of acute respiratory tract infections. In Hong Kong, influenza A and B accounts 50% of the viral respiratory infections, followed by respiratory syncytial virus, which accounts for 20% of the cases. Parainfluenza and adenovirus also accounts for 50% each. Other than these viruses, human rhinovirus, human coronavirus, and enterovirus are also common respiratory tract infection pathogens. All these viruses can cause seasonal colds that lead to rhinorrhea, sore throat, and cough, and they can further infect the lower respiratory tract to cause bronchiolitis, pneumonia, and obstructive pulmonary diseases. Bacteria are significant pathogens that can lead to severe clinical manifestations. The common bacteria that can lead to upper respiratory tract infection include Streptococcus pyogenes. It is a group A beta hemolytic streptococci. It is transmitted through respiratory droplets, and it can cause an acute outbreaks of sore throat in schools. Corynebacterium diphtheriae can cause inflammation of the pharynx and tonsil, leading to swelling of the entire area. Bordetella pertussis can cause whooping cough, leading to fever, malaise, and uncontrollable cough. In Hong Kong, children can receive DTaP vaccine to prevent diphtheria and pertussis. So in Hong Kong, they are less likely happen. And there are many bacteria can lead to severe pneumonia. They are Streptococcus pneumoniae, Haemophilus influenzae. Mycobacterium tuberculosis can lead to tuberculosis, TB. It is a highly infectious bacteria that we will discuss more later. Other than these three types, Klebsiella, Pseudomonas, Legionella, can also lead to severe pneumonia in immunocompromised patients. Fungi can also lead to opportunistic disease in the aged and immunocompromised. cryptococcosis, aspergillosis, and pneumocystis pneumonia are the common fungal opportunistic disease. To identify the pathogens, we prefer nasopharyngeal swabs or throat swabs. To test upper respiratory tract disease, for lower respiratory tract pathogens, we prefer sputum, tracheal or bronchial aspirates, bronchial alveolar lavage. Sometimes we need lung biopsy to confirm the infection. Sometimes we need to confirm the pneumonia condition by lung biopsy. There are different diagnostic tests for respiratory infection. Immunoassays are usually rapid tests, can give you the results within 2 to 3 hours. It is based on antigen-antibody reaction to check your immune responses towards a particular pathogen. Nucleic acid amplification tests can also provide results within several hours. It is based on DNA or RNA amplification and detection of the pathogen. Viral or bacterial culture, it is based on the cultivation of active and live pathogens. So the results will be obtained within several days. Although there are many methods to diagnose this infection, to detect the pathogens, each test has its own advantage and disadvantages. Immunoassays are rapid methods, but it is less sensitive, especially when the viral or bacterial load is not high enough. Molecular tests can also give you the result in a short period of time. It is high sensitive and specific, and it can detect multi-pathogens together in the same time, which increased the diagnostic yield. However, it can only detect the presence of the DNA or RNA of the pathogen. It cannot differentiate active or latent infection. Viral and bacterial cultures can prove the active infection and able to identify some new types of pathogens. It can provide isolated pathogens for further drug susceptibility tests. So it's still important laboratory test to confirm an active infection. Although it is time consuming and labor intensive. Tuberculosis caused by Mycobacterium tuberculosis is a kind of acid-fast bacilli. It requires special laboratory tests to screen and diagnose. Common screening tests include sputum smear microscopy, so sputum sample is required. Another one is interferon gamma release assays, IGRAs. These require blood sample. If there is a positive screening test result, we will proceed to diagnostic tests, including molecular tests using real-time PCR or multiplex PCR, and TB culture, which can include drug susceptibility tests. Similarly, different laboratory tests has its own pros and cons. Sputum smear microscopy is a fast test, is a rapid test, can provide you the results within an hour. It can screen the presence of acid-fast bacilli. However, the sensitivity is low, and it can only identify acid-fast bacilli, including the pathogen leading to TB, but not specific to it. IGRAs can also provide rapid results, but it is used to detect the immune response with TB exposure. That means it cannot differentiate active or latent infection. Molecular tests are sensitive and specific, and some of the tests are able to detect particular drug resistance also, but the cost is really high. Same to IGRAs, it cannot differentiate active and latent infection. So TB culture is still the golden standard to prove active infection, to perform drug susceptibility test, although the culture time requires 6 to 8 weeks and it is labor intensive. Other than infection, for the rest of the pulmonary diseases, there are some other tests to assess the lung function and the severity of damage to the lung. Arterial blood gas ABG can be used to diagnose pulmonary disease and for disease management. It can check the effectiveness of gas exchange in the lung by measuring the partial pressure of oxygen and carbon dioxide. It can also test the acid-base balance in our body by checking the pH and bicarbonates. To collect blood sample for ABG, physicians should collect arterial blood in pre-heparinized syringe. The sample should avoid any hemolysis or the presence of air bubbles. The syringe should be sealed and transported on top of ice immediately after collection. So allow medical technologists to analyze the sample within 30 minutes. Cytological or histological diagnosis can use to classify inflammatory reactions and also to confirm fibrosis, infections, or neoplasms. For anatomical pathology tests, we prefer tracheal or bronchial aspirate, BAL, endobronchial or transbronchial biopsies, or tissues obtained during surgery. Samples will be sent to anatomical pathology lab to perform psychological or histological tests. Cell blocks and tissue slides will be prepared by medical technologists. Pathologists will examine the cell morphology and test results to make diagnosis. Now, you should know the most common cause of pulmonary disease is viral infection, and you should know the potential use of the following samples in pulmonary disease diagnosis. Finally, please think about, is there any potential pre-analytical errors of pulmonary disease tests? For example, the volume of sample, the quality of sputum, etc., and the pros and cons of each pulmonary disease tests.